Welcome. My name is Cheri Stoka, and I'm going to be presenting how to execute for optimal weight loss with semaglutide. So I'm going to get right in. I'm speaking specifically about Wegovy, and semaglutide is an FDA-approved medication for chronic weight management and type 2 diabetes. This is a weekly subcutaneous injection. Semaglutide is a synthetic hormone that mimics GLP, otherwise known as glucagon-like peptide, that affects areas of the brain that control appetite. It also affects the pancreas and improves insulin sensitivity. Semaglutide slows gastric emptying and reduces food intake. So it has multiple mechanisms that help with weight loss. So just to talk about the FDA-approved conditions, diabetes type 2, it is approved for, and this is in combination with diet and exercise to improve glycemic control. And it is proved to reduce a risk reduction of major cardiovascular events such as cardiovascular death, non-fatal myocardial infarction, and a non-fatal stroke. It is approved for weight management or chronic weight issues, again, as an adjunct to a reduced calorie diet and increased physical activity for chronic weight management in adults with a BMI of greater than or equal to 30, or a BMI of greater or equal to 27 in the presence of another comorbidity. So if you have a BMI of 27 with hypertension, this would be approved indication for its use. Weighless MD is a weight loss and wellness clinic, and we use semaglutide for the following conditions. So it is for anyone who is really looking to lose weight, primarily, over 15 pounds. It is for anyone who does not have any contraindications or precautions, anyone who wants to improve their metabolic health. It's for anyone who wants to control their appetite and cravings, anyone who has yo-yo dieted their entire life and are looking to gain better control of their weight. It is for anyone who is willing to make small changes to their diet, to their lifestyle, and other things that may be going on that's really prohibiting them from maintaining weight loss, and anyone who has insulin sensitivity or an imbalanced blood sugar regulation. So as you can see, we use semaglutide for many different conditions related to weight, but at the end of the day, we want to make sure that it is a good fit for the patient, because everyone presents with various, medical histories and such, and we absolutely just make sure that it's the right fit for the patient. So just to talk a little bit about diabetes for those who are not in the medical field. So diabetes is a chronic metabolic condition that causes sugar to build up in the blood. This is due to insulin resistance. So over time, the cells stop responding to insulin. And this begins to cause a cascade of events. So essentially, the body no longer metabolizes sugar and accesses calories or energy as it should. So sugar cannot get into the cells to be used for energy. So it is converted into fat and is basically forced into the visceral areas to be stored. When it goes into the visceral areas of the body, this type of fat over time becomes very inflammatory and becomes very toxic. Metabolic dysfunction starts way before you start to see these things happen. You start to note certain labs that are indicating that, you're starting to develop, say, prediabetes or other metabolic conditions. But just keep this in mind, because in our medical system, we're very, very reactive to health. And at Weighless MD, we're really trying to get people into a healthier state and be very, very proactive about their health. Metabolic dysfunction can be a number of different things. It can be blood sugar dysregulation, hyperlipidemia, hypertension, obviously hyperglycemia, or a high visceral fat, which is often correlated with your waistline. Glycemic variability can be the root problem of metabolic dysfunction. And you can see this starting to develop years before other conditions start to manifest. So glycemic variability is simply blood sugars that are fluctuating all day long. So you can see in this graph here, you see the shaded green. You want your blood sugars to stay relatively, stabilized throughout the day. But what is happening now is people, the foods we're consuming, the stress that we're under, the lack of sleep, you name it. There are so many reasons why people are affected by this dysregulation, and we don't even know it. So over time, it's silently basically destroying our health. Glycemic variability is, ultimately causes this insulin resistance or sensitivity. It begins the process of inflammation in the body, systemic inflammation. You start to see this dysregulation of hormones. And again, the fat stores in the visceral become very inflammatory. So as you can see from the image here, visceral fat is finding its way around, or surrounding all of the vital organs, which is different than the subcutaneous fat because it is the fat that is the pinchable fat, whereas the visceral you cannot pinch because it's deep within the abdominal cavity. But this is the fat that causes all of the problems. Chronic inflammation is basically the beginning of all disease states, and visceral fat now in this day and age is often the root of inflammation because of our obesity pandemic. So when you look at inflammation, basically it could be the start of any type of disease that you have the propensity to develop. So it is not like, oh, okay, I have inflammation, everyone's going to develop diabetes or Alzheimer's disease. It is really, there's other components, obviously maybe genetic or other things that come into play, but the root is the inflammation that the body is enduring over a period of time. When sugar stays in the blood, it's a problem. It's a very big problem. And most people that have diabetes, they don't understand what diabetes is actually doing to their body. But when you think about it, if you have syrup as your blood, that's going to be a problem. The sugar is becoming inflammatory. It's going to break down the vessel walls. It's going to clog things up, so blood flow is not going to get to certain areas of the body. This is why we often see this neuropathy that happens in the fingers and the toes first, because the blood flow cannot get to those micro vessels, and those are the first to go. So it is really important to understand that clearing sugar, managing blood sugars is crucial to your health. So there is a lot of talk about semaglutide, and in our experience, Weighless MD, we are as holistic as we possibly can be. We're always trying to heal the body and get the body into a healthier state for long-term weight loss. However, we use semaglutide because we have seen that it helps repairs people's metabolic health, or can improve people's metabolic health. So over 130 million Americans have prediabetes or diabetes. So again, this is a metabolic dysfunctional state. UNC School of Public Health research recently, I think this was a couple of years ago, showed that 88% of Americans have some type of metabolic dysfunction. That's pretty significant. So now you see why semaglutide really can help so many people, because the majority of people walking around have some type of metabolic dysfunction. They just don't know it, or they don't really know how to define metabolic dysfunction. It is estimated that 80% of people with prediabetes don't even know it. And many people, again, have some type of metabolic dysfunction, whether that's high triglycerides, high cholesterol, high blood pressure, even high HDL could be a form of metabolic dysfunction. And really, they don't have any idea. They just think, oh, you know, everyone else has this too. I'll just take a medication and all is well. You know, when you take medication to bring those levels into a normal range, that does not mean you're metabolically healthy. That's just making you feel more comfortable that the levels look to be within a normal range, but that's not getting you into a healthier state. So the reason why we use semaglutide is because reducing calories and telling people to exercise more no longer works, because people are metabolically inflexible. They are in a state where the body is no longer working as it should. So how does semaglutide work? It improves insulin sensitivity, so now sugar can enter the cell to be used for energy. That is one thing it does. With a balanced diet, the effects are greater. If you continue to eat poorly, it's going to be difficult to really normalize these insulin and blood sugars. So again, that's why I'm going to get into really how we execute our program so that we get optimal results. Semaglutide is absolutely going to suppress the appetite. It is going to improve fullness, so people are more likely to adhere to our diet and nutrition recommendations. You feel better. People begin to feel better because when blood sugars are balanced, so many things in the body start to normalize and work better. So a little bit about insulin sensitivity. When you improve your insulin, you have better blood sugar control. Again, insulin is the primary regulator of blood sugar. When your insulin works better, you have more sustainable energy. So if you can't get your food into the cells to be used for energy, the sugar that is supposed to get into the cell, you could be eating all day long, and if the food is just staying in your blood, that you could feel depleted even though you're eating, you know, a lot of food. If you do not regulate your blood sugars, you actually cannot burn fat. You cannot access fat stores because insulin is kind of the fat storing hormone. Improved insulin sensitivity is going to reduce inflammation in the body. Hence, this is going to reduce cholesterol levels. It's going to start to normalize the lipids, lipid balance in your body. And you're just going to start to see so many things start to self-regulate and work the way that it is supposed to work when you start to manage the blood sugars and hence, you know, the insulin response. So if 90% of Americans have some type of metabolic dysfunction, shouldn't everyone be on semaglutide? Well, not necessarily. Semaglutide is definitely not for everybody. So there are absolute contraindications, which would be thyroid nodules that have not been checked for cancer. So you would not want to start somebody on semaglutide. If they've had a prior allergic reaction to GPL1, a glucagon-like peptide. Medullary thyroid carcinoma. So this is rare, but it would be an absolute contraindication, as well as patients with multiple endocrine neoplasia syndrome. And also pancreatitis. If somebody has current pancreatitis, this is not going to be the right program or medication for them. Other precautions to keep in mind for starting patients on semaglutide would be if they have a history of recurring bladder issues, history of significant gut issues, constipation, reflux, diarrhea, IBD, IBS, all of these things. We'll talk a little bit more about that. History of anorexia or binge eating. This could definitely be a precaution. Anyone who's had recent surgery or upcoming surgery, so you want to be off the medication 2 to 4 weeks post and pre surgery. And this is really due to the anesthetic that is going to slow gastric emptying. And again, you don't want food to sit in your stomach during surgical procedures. So there's some other reasons too, but it's just, we see patients that come to us, they've been on semaglutide and this was never told to them. So we always make sure that people understand they should not be on semaglutide, if they have surgery coming up. And of course, stopping the medication 3 months before trying to conceive. So this is our protocol. This is part of our protocol, our warnings and precautions, a little extended view of it, but endocrine cancer, risk of thyroid C-cell tumors, acute pancreatitis, as I mentioned, and acute gallbladder disease. So these definitely are to watch out for and be mindful of. Other precautions, somebody who struggles with hypoglycemia, they can't seem to manage their blood sugars, anyone with acute kidney injury, diabetic retinopathy, and issues with their heart rate. So they can't, they have a racing heart rate or they can't seem to stabilize it at a normal rate. So how are we different at Weighless MD? We are a weight loss clinic, obviously, so we are very comprehensive when we are executing certain programs. So while patients are on semaglutide, they're going to receive a very comprehensive body composition analysis throughout the duration of their program. We are going to provide specific meal plan and nutrition guidelines to them. This is a program that allows for flexibility, so that is the nice thing. Our patients come in every 2 weeks for counseling with either our nutritionist, our health coach, or other practitioners, where we are talking about either nutrition, certain behaviors, exercise, but our whole goal is really to set actionable goals, maybe 1 or 2 actionable goals for our patients so they move along the spectrum. It's not always just about the food. There are, weight loss is multifactorial. We talk about it all the time. So sometimes we address other things as well. So at our biweekly appointments, we're either adjusting meds as needed. We're talking about certain supplements that they can add to address other imbalances. We're recommending some diet, modifications. One thing we notice often is that people are not eating enough. They're not eating enough protein, or they're eating small, frequent meals all throughout the day. And so those are big issues because that is going to lead to either muscle loss, or it is going to affect their metabolic health. So we have to be managing these things as people are going through program. And then another very important part is symptom management, which I will talk a little bit more about. So prior to every visit, so every 2 weeks, our patients are going to receive an automated assessment. And so we're gonna dig deeper into how they're feeling in all areas. So certain imbalances, you can see there, frequent or sugar cravings, are they feeling shaky, weak, dizzy, how is their energy and sleep? Here we're looking at digestive, GI issues, because as you know, the most common side effects are GI related. So we want to make sure we're on top of that. Maintaining muscle mass is so important. And what's really important to us at Weighless MD is not only us measuring things, We want our patients to be empowered by this information. We want them to know if their muscle mass is declining, or is their muscle mass improving? So we're asking these questions, so they have to be held accountable for it. We're also asking about the diet, because the diet is crucial. If you continue to eat a crappy diet, you're not going to get the results that you hope for. So we are not, drill sergeants when it comes to the diet part on this particular plan, but we are definitely helping and supporting healthier habits that work for the individual. And we recommend that everyone document and log all of their food through our app, but we will also just ask them on their assessment, give us an idea of, what you ate in the last 24 hours. And again, more questions about muscle mass, some behavioral changes. What are some behavioral changes you've made while on semaglutide? How can we help you this time? And then we always are assessing, are we helping you? We have to move it. I say it all the time. We have to move the patient along the spectrum. So our program protocol, which all of our franchisees get in a very detailed document, but essentially how this is kind of a shortened form. Our admin is going to make sure that all of our paperwork has been sent out to the patient prior to them coming in. So that would include the consent forms, the medical intake form, and we're always taking before and afters photos so that we can upload these in our EHR and patients can see their progress. The initial visit typically takes about 45 minutes. And at that visit, one of our practitioners, our providers, is going to review the medical history intake form, review all consents and contraindications. We do not require blood work. However, we really encourage people to either bring their blood work, or we can do blood work on site for them. So that is, we leave that up to the patient. There's nothing on general labs that is going to disqualify a patient from starting semaglutide, because we go through, a pretty intense medical history, and do vitals, complete the ROS subjective documentation, the physical exam to include heart, lung, thyroid, extremities, etc. So just kind of a comprehensive physical assessment. We will do our in-body composition and review results with the patient. So this is looking at not only weight, but it's looking at muscle mass, fat, lean body mass, subcutaneous fat. Is there water imbalances in the body, water retention, etc. So we're getting a really good look at what components are making up their total weight. This is a subcutaneous once-a-week injection, so the patient is instructed on how to do this at their visit, and we require them to take their first injection on site. And then, because these are bi-weekly visits, we give them one additional injection to take home with them so that they can obviously take that injection in 1 week, and then they would return at their bi-weekly visit. And then, of course, we chart all of the necessary components to the visit, and we have templates that make it very easy for our practitioners. When the assessment piece is done, the patient will either meet with one of our nutritionists or RDs, but any other provider can absolutely do this. We're going to review their goals. We are going to review our meal plan that we provide for all of our patients. And, with all of our programs, we've created videos and automations. So we're not spending hours going through the meal plan. We basically highlight the important pieces within the packet, and then we tell the patient that the nutrition packet video is available on the app, because all of our patients get set up on our Weighless MD app per the specific program they're on. We highlight and discuss the importance of logging food. We cannot help anyone troubleshoot if we don't know what they are eating, because that's going to be the first thing we want to kind of get control of. And we also have many different supplement protocols that we can send to our patients, or we can recommend at their visits. And the two most popular ones for semaglutide are the semaglutide supplement protocol, which includes a number of specific supplements, and or our protein supplement options, which provides education on the importance of protein for muscle mass, and then gives different food related products such as protein shakes, protein bars, actual protein like protein and things like that. So then the patient will follow up at week 3. So this is their second visit. And they will meet with one of our providers, and they will, again, review the diet logs, their weight, their hunger, obviously their weight loss, and they will have filled out their pre-appointment assessment. And at that time, you can gauge their, what their symptoms are, and you can address that accordingly. You can talk about the features and benefits of our lipotropic injections, which are our intramuscular injections that also help with supporting liver health and fat metabolism. Like I said, we're making suggestions and modifications to the diet, and we are addressing, anything that the patient would want to talk about. Maybe they're having a lot of hunger the last 2 weeks. They're not drinking any water. We have many different handouts that support the needs of the patient. And follow up with any questions about supplements, really starting to identify what the needs of the patient are. And typically during semaglutide, digestive health is really, really important, just because it can exacerbate any type of issues that people are having with gut health. So typically we're either recommending our total gut reset products, or just a probiotic, maybe magnesium, digestive enzymes, etc. And then at that visit, we would dispense 2 additional injections. The patient then will come in for their monthly visit, which is approximately 30 minutes. At this visit, we do another full body composition analysis. So we want to see not only what they lost, but how much they lost, but what they lost. So was there muscle loss? Was it visceral fat? Was it just total body fat? So really getting a gauge on how their metabolic health has changed over the month. We're going to review the diet. We're going to review any type of supplement questions, regimens, etc. And we're going to just really educate and support per the symptom assessment questionnaire. We try to set 1 to 2 goals at every visit, and we send that to the patient, because this is what is going to move the patient along. It is not just about having a conversation and saying, we'll see you in 2 weeks. We have to be able to come up with 1 to 2 simple goals for the patient and make sure that those goals are actionable and that the patient agreed to those goals. Because it's really not about what we want the patient to do. It's working with the patient on what they think they can do. So there's a big difference in that. And again, we talk more about this, but I did want to mention that. Again, we do the monthly full in-body. So again, we're looking at everything, not just their weight loss. And then if they continue, we are dispensing another 2 injections. How long should patients stay on semaglutide? Well, semaglutide is approved for long-term use. So as we know now, it is okay for that. But for us, our patients stay on it until they either achieve their weight loss goals. They stop. Some have to stop due to the cost of it, because it is not a cheap medication. But we always have different solutions for patients if it is cost related. Some patients will continue on a low dose semaglutide so that they at least can maintain or lose more slowly. So let's say, somebody is at, 37.5 and they want to start weaning off of it, and we lower their dose, we keep lowering their dose so that they may choose to stay on the lower dose for a longer period of time. The patient's metabolic health really dictates their weight gain vulnerabilities. This is really, really important. We can tell a lot from the in-body based on their visceral fat. If they have an elevated visceral fat level, they have metabolic dysfunction. It's just kind of goes hand in hand. However, we do have we have a metabolic test panel that we offer our patients if they really want to dig deeper and find out where their metabolic health status is at. Our patients stay on semaglutide for an average of 6 months, and some they're over the 1 year, not quite the 2 years, but some are more long-term. We haven't really had anyone on quite that long, like 2 years, but we've been using it now for almost 2 years. Semaglutide dosing. So we're going to talk a little bit about this. Semaglutide is a titratable medication. Titrations and dosage depends on the vial size and concentration. So the reason why I put this in here is because people will ask us what their dose is. They will ask us certain questions, but there are many different concentrations, many different sizes. So it's not a standard protocol for all semaglutide. So if you received 12 units at a clinic prior and now you're on 25, it may be that the concentration was different. So just keep that in mind, especially, or if you're seeing patients that they're going to ask questions about that, and you really just can't answer it because you don't know what they were at. Most patients will do well at the mid-range dose. The higher the dose, the more effective, but you also get more potential side effects are usually transient. We usually can work with our patients through this, and they subside over time. But if there are patients that have more significant side effects, it's usually because they come to the table with some pre-existing gut issues. And oftentimes we really need to dig deeper into that and address those things first. As far as the dosing, we are keeping our dosing proprietary to our franchises. So I'm not going to get into a lot of detail on that, but there's standard recommendations from your pharmacy that you have access to. Managing dosing. So if a patient is losing weight and has minimal symptoms, we keep the patient on the most effective, lowest dose as possible. There's no reason to bump up if the patient is doing well and they're losing weight and their hunger is suppressed, etc. If a patient has increased symptoms, then you want to decrease to the last tolerated dose, regardless of weight loss. You really want to manage the symptoms because that's going to get you to a place where the patient is more successful in the long run. Be advised that we increase price for higher doses. You just have to, because again, the medication is expensive and the dosing can vary quite a bit. You definitely want to monitor the patient when titrating. As I noted, increased dose may increase side effects. If the patient does not lose weight after 3 months, then you would consider stopping semaglutide and considering more of strategic weight loss. Our strategic weight loss programs are very aggressive in getting the patient into a healthier metabolic state, kind of cleaning up some gut issues. So that might be something that you do first and then move to semaglutide. Keep in mind that some patients will want to continue with semaglutide just to prevent weight gain. Oftentimes they will want to do like a lower dose, which is totally fine. We have a maintenance program for that, but that is an option for some patients. And always keep in mind that every patient is different and every patient is going to have their sweet spot dose. So even though it's a titratable for most meds, it's going to be a monthly titration, but every patient is very different. So at their biweekly visits, they're going to receive 2 injections at each visit. Again, injections are once per week. They must be kept cold and away from light. We do not give more than 4 injections at a time. They should not stay in the syringes for longer than 4 weeks. If hunger occurs, a patient might experience hunger suppression or might not until they titrate up to the next dose. So you may see more hunger obviously at the beginning because they're still in that, titration mode. If a patient has significant hunger while taking the injection, you want to obviously look at the dose, but you also want to review the diet, because the diet can play a huge role in hunger and fullness as well. The more carbs and sugars one eats, the less effective the medication will be, hence the less effective the weight loss will be. You want to review exercise, water intake, again, all of the other things that really come into play. What we're seeing is that so many people are just getting this medication and they're affecting themselves, and they don't understand all of the other important components. Following our meal plan absolutely leads to more success because we understand a diet for more metabolic, health. And keep in mind that sometimes you may need to up the dose for some people quicker, and for them to, get the results that they're looking for earlier in the process. Our semaglutide assessment, again, as I showed you, it's an automated assessment that is sent to the patient prior to coming in. Providers are expected to review this and plan for the visit. Patient will identify areas of their needed support, their symptoms, their diet compliance, etc. And it's really up to the provider to move the patient along the spectrum. Again, we are here to help the patient get into a healthier state. Yes, weight loss is important, but if the weight loss is not, in a healthy way, then the patient is going to resort back to where they were, very quickly. Small changes go a long way. Sometimes, some of the goals for the week can be so simple. And so really recognizing that these goals do not have to be large and, hard to obtain. It really can be something as simple as, next time you show up for work, park 10 parking spots back from where you normally would. So, little things like that. So will this work for your patients? Or if you are someone looking for semaglutide, will this work for you? Most patients have metabolic dysfunction, so yes, it will help. If there are underlying gut issues, we really recommend not ignoring that. So we recommend either our total gut reset program, or there are many other things you can do to support the gut while on this program. If it leads to more testing of digging deeper into that, then we certainly do that. If a patient has emotional issues with food and cravings and things like that, then you must really be able to pivot if necessary. Sometimes this does require a different professional if some of those issues are very deep rooted, but you will, if you are dealing with, patients that really just can't overcome certain things and they're not experiencing any of the benefits of semaglutide, then you really kind of take a look and see if there might be something better for that patient. Super important to understand that obesity is multifactorial and there are other things that come into play. Again, gut health, hormones, food sensitivities, toxicities, inflammation in the body. So we are working to get the body into a healthier state while on semaglutide, but sometimes we do need to look into other things. The type of diet that we provide while on semaglutide is a balanced, low-carb diet. It does not require extreme calorie restriction. Frequent eating, which is a problem on this because of the appetite. So 3 meals plus snacks will keep you in a state of metabolic dysfunction. So we don't encourage people to eat frequently throughout the day. We encourage people to spread their meals out, eating no more than 3 meals a day. Intermittent fasting may be a great option for some people, and exercise is absolutely going to enhance the results. Will you gain your weight back? This is talked about a lot in the news, in the media, and the answer is it depends on your metabolic health. If you start a program and you are metabolically unhealthy, and you finish a program and you're metabolically unhealthy, well, then you'll probably gain it back if you haven't made some pretty significant changes. But if you are now metabolically healthier and you have found certain things that you're going to sustain healthy habits, then you're likely not going to gain your weight back. So the question you must ask is, what did you lose when you lost weight? Did you lose muscle, fat, visceral fat, etc.? So all of this, we're able to basically show the patient where they're at metabolically after they finish. Are they someone who still has blood sugar dysregulation? More and more people are checking their blood sugars, which is nice. We would like to see a lot more people doing that. It is expensive to get like the CGM, so that is a challenge. But I'm often shocked at how even people with diabetes don't regularly check their blood sugars. This is one of the best ways you can really better understand your metabolic status. Do you have chronic inflammation? Are you taking other medications? Some of our patients come to the table with a slew of meds. And what bad habits do you think you can't give up? What will you continue? So those will all play a role in the propensity of you gaining your weight back. Signs of metabolic dysfunction would be sugar cravings after a meal, sugar cravings that aren't relieved by eating sweets. You're tired after you eat, brain fog, visual problems. You go in to get your blood sugar test and your fasting sugars are over 90. You have high cholesterol, high blood pressure. You're on multiple lifestyle medications. And again, we have a metabolic health quiz or a metabolic health panel. Blood spot, it is easy to do. So we do have different ways that will help people really dig deeper into their metabolic health. So the big question that people are asking, or there's more research that's coming out, I'm very interested in it because any type of medication that I would bring to my practice, I need to make sure that it's very, very safe. So we are hearing about these gut-related issues, gut paralysis, gastroparesis. There are patients that are experiencing that. So you see that in the JAMA study, 1% of Ozempic patients had gastroparesis. I don't know what the real amount is or how prevalent it is, but people are experiencing these things. SIBO, so small intestinal bacterial overgrowth because of the slow motility, could be a long-term effect. There has been some noted suicidal thoughts, pancreatitis. So maybe you didn't know you had an inflamed pancreas and now it pushed you into pancreatitis. Bowel obstruction has been reported in ileus, acute gallbladder disease. So there was an insurance company that looked at claims for 16 million patients that were prescribed a GPL. This was the class. This was not semaglutide itself or Wegovy. And you can see just some numbers there. So I take every study with a grain of result like nobody's business, because you want to know who is actually conducting the study. I mean, this seemed to be very fair. Obviously, they're going back and looking at certain conditions based on the medication, but just be mindful when you're looking at other studies. So again, 3.6 times more likely to develop gastroparesis, 9 times more likely to develop pancreatitis, and 4 times more likely to develop a bowel obstruction. So being very mindful of that. That's why we're asking certain questions when patients are coming in every 2 weeks. The positive effects that we're hearing is decreased risk of cardiovascular events, improved glucose regulation, obviously. Some studies are showing neuroprotection, so protecting the brain. So all of this has to do with blood sugar. I mean, obviously glucose regulation and cardiovascular, it's all foundationally the blood sugar management. Of course, weight loss, and then obviously decrease in hunger and appetite control for longer periods of time. So how do you keep it off? Now, hopefully you made some changes, right? So we can't be naive to think that you go on semaglutide for 3 to 6 months, you lose 30 pounds, and you go back to living all the way that you were. No, you have to be mindful of the fact that, you have to start living a healthier lifestyle. It doesn't have to be perfect, but you have to make some changes, and everyone is different. We do have all natural supplements that mimic semaglutide and help improve muscle mass. So we're recommending these when a patient finishes our program. We provide healthy eating plans for sustainable weight loss. So again, we've been working with patients over the course of their program. So they are going to be more equipped for being on their own, and they now are understanding what they should be eating. Again, some patients will choose to do a low dose semaglutide just to help keep the weight off. We have other maintenance programs that allow patients to come in every month or every 2 weeks just to do a check-in, to do a body composition test, etc. We work with patients on exercise or other, lifestyle changes that may be specific to their situation. And the diets that we're recommending really will vary depending on what the patient's health status is at the end of the program. So if somebody had 100 pounds to lose and they lost 30, well, they still are in an unhealthy state. So that is the conversation and the support that we have to provide. So this is just a snapshot of our results. We have many, many patients on semaglutide. We started to pull some numbers. So we have some numbers here. 31 patients who did semaglutide for up to 12 weeks lost an average of 18 pounds, and that's 1.5 pounds per week. The muscle loss in the 12 weeks was approximately 2.4 pounds, and the visceral fat went down 2 points, which again, visceral fat is measured by centimeters squared. So those are the average of, so again, some patients are going to lose more, some are going to lose less. And then we looked at 21 patients that stayed on semaglutide for up to 24 weeks. And the total weight loss was approximately 31 pounds. The average weekly was 1 pound after the 12 weeks. So we saw a little bit of the drop off there. A little bit more muscle mass muscle mass loss, and visceral fat loss was pretty significant. You do expect to lose some muscle when you lose weight, but we are making sure that patients are not, we want patients to stay around 1 to 3 pounds. If they've lost a significant amount, you might see a little bit more, but then we want to make sure that they're ramping up and that muscle mass should come back. Just a snapshot of some of our patients. You can see here, 8 weeks semaglutide, 10 pounds, body fat went from 32 pounds to 24 pounds. Muscle mass stayed stable, so that was awesome. Here we had 12 weeks of semaglutide for this patient, and then he also did one of our strategic weight loss programs. He started at 275, went down to 224. His visceral went from a unhealthy 20 to almost a normal range of 12, and his body fat in pounds, so it was significant. So he started at 95 pounds of his weight was fat, down to 53. Here's another 12-weeker, 150, started at 150, went to 132. Visceral fat went down 3 points, and body fat, she lost 12 pounds of just fat. So these results are, you know, again, it's the medication is allowing the body, you know, to really access those fat stores. This is a 6-month semaglutide patient. She started at 176, got down to 141. I mean, her entire life changed. I mean, just how her confidence and her demeanor, everything was changed because of it. Her visceral fat was 16, went to a normal level of 10. Body fat started at 73. So, I mean, if you just think about that, like over 20 pounds of just fat she lost. So that is it. Hopefully that was helpful, and we'll see you in the next video. Bye-bye.